Afternoon, I'm Madonna Guy, and you're here at the Natural Alternative Podcast. Welcome. There's been so much information in the news lately about people with brain disorders, all sorts of things, dementia and memory loss and strokes and Alzheimer's, and you name it, it seems to be in the news. So I thought I'd touch on a few really basic natural therapies that have been proven scientifically to support all sorts of symptoms. So I'll just go through them bit by bit. But, on top of it all, I just want to say, I just don't find brain stuff that complicated. It's really about reducing inflammation in the brain, and lots of substances reduce inflammation. I remember being at a seminar with Metagenics about 10, 15 years ago. There was a Dr. Jeffrey Bland, and he's like the father of functional medicine. And he really talked about how everything that happens in our body is inflammatory. And then he went on to talk about how cardiovascular disease is inflammatory, dementia and Alzheimer's is inflammatory, autism and Asperger's and the whole spectrum is inflammatory, asthma, sinusitis, hay fever, they're all inflammatory. So if you start quenching the inflammation naturally in your body, you'll start to improve your health. But then the other side of things is you've got to look at what's causing the inflammation. So is it stress? Is it cortisol? Is it toxins? Is it neurotoxins? Is it our diet? Is it stuff coming from the air? Is it stuff coming from our water supply? Is it stuff coming from the walls in our house? What is causing that inflammation in our body that's creating this downward spiral of our health that we're seeing in such a big way? I've been a naturopath for over 27 years, and for the last, at least 10 years, I've been sort of thinking everything is getting harder and harder to treat. It makes no sense. I used to be able to resolve health issues for my clients so much more quickly and easily these days. And the more I look into it, the more it makes sense. So let's just get into a few little bits and pieces, because our brain is so important. There is nothing that happens in our body without the permission and function of the brain. So let's go have a look, because your brain, it's got over 100 billion neurons, nerve cells, and more than 100,000 miles of blood vessels. It's responsible for controlling everything from walking, talking, thinking, and breathing. Therefore, protecting your brain, it's a matter of life and breath. So a healthy brain is crucial at any age, but it's particularly important to safeguard it when it's still forming up to the age of 25 and in older adults. If you're having lapses in memory and attribute it to senior moments, the signs of mild cognitive decline, MCD, may already be in effect. But don't worry, numerous studies have linked specific nutrients and natural substances to delaying and even reversing MCD, mild cognitive decline. I was at a seminar about 10 years ago, and there was a researcher from the States, and she came in and she was talking about B12. So she actually had found a connection between cognitive decline in her clients with B12 deficiencies. So what she would do was 4,000 micrograms a day. Now, in supplements here in Australia, that's quite pretty hard to get. So the most I have found is 1,000 micrograms. So it's equivalent of 4 tablets a day. And then you do that for 3 weeks. If the memory starts to improve within that 3 weeks, it can be a chronic B12 deficiency. So what's the solution? Taking B12 long-term until you start to see an improvement. Now, from a perspective of B12 injections, here in Australia, each B12 injections is equivalent to 2,000 micrograms. So it's the equivalent of 2 injections per day or 4 tablets per day to really start building up that B12 in the system. And B12 deficiency has also been linked in with things like multiple sclerosis. There's several types of anemia that are linked in with B12. Chronic immune system issues and autoimmune diseases can all be linked in with B12. So B12 is a great one to throw into if you get a really good one as well. So make sure you get a good quality B12. And I look for methylated B12. Curcumin. Let's talk about curcumin, curcuminoids, and turmeric. So turmeric is the herb. Curcumin is the part of turmeric that is active, that actually creates the benefits. It's actually one of many polyphenols that are in turmeric, but it has lots and lots of studies done on it. So it's the compound responsible for turmeric's bright orange color. It's a powerful antioxidant linked to dozens of health benefits. One purported benefit is that's been extensively researched is its ability to protect aging brain cells, an important effect at any age, especially when any symptoms of dementia are present. A 2012 study published in AU on the effects of turmeric on Alzheimer's patients with severe behavioural and psychological symptoms of dementia showed that patients improved remarkably as a result of consuming 100 milligrams of curcumin daily for 12 weeks. That's not even a big dose. So if we can get that sort of result, with even such a small dose, imagine what extracts that are highly specific can do as well, because we talk about fully activated curcuminoids in some of our products, and that's how as naturopaths we know how it's been standardized. Symptoms, but the good news is that it helps with the moods as well. So symptoms such as agitation, anxiety, apathy, and urinary incontinence began improving after patients were prescribed turmeric powder capsules without any adverse reactions noted. After 3 months of treatment, neuropsychiatric scores showed that symptoms were less acute and the burdens on caregivers had lessened. After 1 year on the turmeric supplement, patients had not experienced a return of prior symptoms of dementia, which is fantastic because obviously that shows that it unravels some of that dysfunction that happens in the brain at the same time. By the way, curcuminoids have been found to be protective against hundreds of dodgy genes. So that's the first one. Here in Australia, there's lots of products out there that have got turmeric curcuminoids, curcumin in, so easy to get a hold of. The next one is ginsenosides. So, what could that have in it? So there's lots of ginsengs on the market. Withania is Indian ginseng, Siberian ginseng, but this one particularly is going to talk about a study to do with Panax ginseng. The thing I love about Panax ginseng is it's the same as Korean ginseng. It works directly on the pituitary gland. So when you have a dose first thing in the morning, you get about 8 times the benefit of having it in other times of the day. So when I'm giving someone something like Adrenotone, which has got a couple of grams of Panax ginseng in it, then if they have like a bigger dose in the morning, just say they've got chronic fatigue and they have 2 or 3 tablets early in the morning rather than having 1 tablet 3 times a day, they're getting up to 8 times the benefit of getting that dose first thing in the morning. A little tip. So while you may not be familiar with the name, ginsenosides are potent plant compounds that have been isolated from the plant called Panax, which is widely known for its healthy roots. Ginseng, responsible for the benefits of ginseng, ginsenosides play a critical role in the body's inflammatory and disease responses and are featured in a deepening catalogue of research that may help and prevent treating inflammatory diseases, including those affecting the brain. A recent study published in Frontiers in Pharmacology explored the effects of ginsenosides and their probable neuroprotective mechanisms in ischemic strokes, the most common type of stroke. These strokes occur when a blood vessel leading to the brain is obstructed. After an exhaustive meta-analysis evaluating the effects of ginsenoside RB1, researchers concluded that ginsenosides have a potential neuroprotective effect that works through an array of mechanisms, including attenuating brain water content, promoting neurogenesis, reducing cell death, and providing antioxidant, anti-inflammatory effects. GRB1 also supplemented energy and enhanced cerebral circulation. It's funny because when I think of Panax ginseng, it's not the thing I use it for. But on the other hand, most of my supplements that contain Panax ginseng are also for either the adrenal support or the thyroid support, which of course is all about improving your energy production. It's just great to know there's double-blind placebo studies out there that are proving this sort of thing and seeing the long-term effects as well. My next one of my favorites, good old Ginkgo biloba. So I've been using Ginkgo for many, many years, and it's one of the ones that has got over 4,000 years worth of anecdotal evidence. So let's just even accept that as, a pretty bloody good herb. So Ginkgo has a long history as a natural health aid with anecdotes back to 2600 BCE. Most Ginkgo biloba supplements are made from the leaves of Ginkgo tree, one of the longest lived tree species on the planet, dating back to more than 200 million years. A single Ginkgo tree can live for as long as 1,000 years. So any wonder these trees may help to improve your memory. A 2015 meta-analysis published in the Journal of Pharmaceutical Healthcare and Scientists looked at the efficacy and safety of Ginkgo biloba extract for the treatment of dementia. It found that taking 240 milligrams daily dose of Ginkgo biloba extract is effective and safe in the treatment of patients with Alzheimer's disease, complicated by dementia, as well as vascular and mild forms of dementia. A human trial on healthy, active young men found that 6-week supplementation with Ginkgo biloba provided a boost in athletic performance, endurance, and antioxidant capacity. The study, published in Archives of Medical Science in 2015, found Ginkgo also elicited better neuroprotection through increased exercise-induced production of brain-derived neurotrophic factor, a biomarker that serves to modulate brain activity and plays a part in neuroplasticity, the ability of the brain to regenerate in a healthy manner. Love Ginkgo, and it's been some of my favorite products are things like Bacopa Complex and Bramitone, and Bacopa and Ginkgo are often used together in herbal combinations because the pair of them helps both the short and long-term memory centers. So that's pretty cool. Next one's resveratrol. So like curcumin, resveratrol is a natural plant polyphenol responsible for the deep color of wine, grapes, and red and blue berries. That's why I like it so much. So actually, resveratrol is the reason why I choose Pinot Noir a lot of the time as my red wine, because resveratrol is much higher in Pinot Noir than other red grapes. And the reason being is that a lot of the places where Pinot Noir grapes are grown are on the sides of mountains. They can sort of live in gnarly, harsh environments. So what does that do to the grapes? It means the grapes have got extra antioxidants because they're actually grown in a space where they need to have extra protection from the environment. So when we then eat those grapes in the form of wine, we're getting higher levels of resveratrol. Unfortunately, I think it did come out that we would need to drink like 5 litres a day to get what you'd get in a capsule. But hey, small things that you go through, for science. So, known to pack an antioxidant punch, resveratrol has been synthesized into supplement form with promises to remedy everything from overweight to heart disease. But what does science say about this trendy panacea when it comes to brain health? A 2017 Australian study tested whether chronic supplementation with resveratrol could improve brain function, cognition, and mood in postmenopausal women. 80 women aged 45 to 85 were randomized to receive resveratrol or placebo for 14 days. Effects on cognition, cerebral blood supply, and arterial stiffness in the middle cerebral artery were measured. Cerebrovascular responsiveness to both cognitive testing and hypercapnia were also assessed. That's excessive carbon dioxide in the blood. And mood questionnaires were administered. Compared to placebo, resveratrol elicited 17% increases in CVR to both hypercapnic and cognitive stimuli. Performance on cognitive tasks for verbal memory significantly improved, as did overall cognitive performance. Mood also improved in multiple measures, indicating that regular consumption of a moderate dose of resveratrol may enhance both cerebrovascular function and cognition. Researchers posited that resveratrol supplementation could potentially reduce the heightened risk of aggravated cognitive decline in postmenopausal women and offers a promising therapeutic treatment for this population group. So resveratrol, it's one of those things that I do muscle test up regularly as a kinesiologist. Once again, it's in a couple of my antioxidant supplements and anti-aging supplements. So I don't tend to use it unless people have something really specific going on. But on the other hand, from a naturopathic perspective, recommending that people take a bounty of beautiful, colourful, bright fruit, berries, veggies daily. You want all the colours of the rainbow in your fruit and vegetables per week. So beautiful, just all the gorgeous colours. And that gives you a lot of polyphenols and antioxidants in your range of food that you're eating. The next one is melatonin. Now, melatonin has only just been deregulated here in Australia so that we can get it over the counter at the chemist for the first time ever. So that's sort of an interesting space, because for 20 years I've been hearing about amazing melatonin effects, and to get doctors to prescribe it here in Australia has certainly been a challenge over the years. Melatonin has garnered fame as a natural sleep aid, but did you know it also protects the brain? A naturally occurring hormone that helps regulate the sleep-wake cycle, melatonin is a neuroprotective agent that may hold therapeutic promise for brain disorders such as Alzheimer's, Parkinson's, and stroke. Secreted by the pineal gland in the brain, melatonin can be taken as a supplement. Supplementation has been shown to reduce the incidence of delirium in older adults. A 2018 meta-analysis of both human and animal studies provided clinical evidence that melatonin treatment after traumatic brain injury can significantly improve both pathological and behavioural outcomes in traumatic brain injury clients. Observed effects published in BMC Geriatrics include reduced size of contusions and cerebral edema and enhanced cognition. The journal Neural Regeneration Research published a 2021 animal study on the effects of melatonin on rats with induced Alzheimer's disease. Rats were administered a 30 milligram of melatonin per kilogram of body weight for 13 consecutive days. Melatonin supplementation ameliorated learning and memory impairments on maze tests, improved their morphology and density of microvessels in the brain, alleviated pathological injuries of cerebral neurons, and decreased the expression of vascular endothelial growth factor and its receptors. Researchers concluded that melatonin supplementation can improve the cognition function of patients with Alzheimer's disease. And none of that is a surprise, because anything that gives you better sleep is going to support your memory long term. So if you aren't sleeping well through the night for whatever reason, you're going to have no choice but to run on adrenaline and cortisol and stress hormones the next day. If you haven't got a good night's sleep, your thyroid hasn't had a chance to recover, your liver, gallbladder haven't had a chance to recover, your brain hasn't had a chance to get that beautiful wash that happens with the lymphatic system in the brain overnight while we're having a sleep. So getting that good night's sleep can be so crucial for whatever way you're able to do it. So by getting that good night's sleep, is it because we're getting a better night's sleep that these things regenerate? Melatonin, by the way, is also an amazing immune stimulant. There were some studies early during COVID sort of indicating that melatonin was one of the things that really helped people get over COVID much faster as well. Now, the next one is an interesting one, because once again, here in Australia, it's sort of in that let's not go there pile, the cannabidiol. So cannabidiol, or CBD, as it's commonly known, is an isolated active compound in the cannabis plant that's been shown effectively to treat insomnia, pain, and brain disorders such as anxiety and epilepsy. Despite demonstrating such powerful effects on the brain, CBD is non-psychoactive, meaning it won't get you high. But according to the latest medical science, it may possess strong neuroprotective properties to support your brain as you age. Now, one of the things that is very interesting to me when I started looking into cannabinoids, which still are not, you can buy them, but there's a huge push to have them legalized. So, we're in a really weird space here in Australia at this point. We still can't grow it. We still can't have our own plants. It's all that sort of shenanigans. But guess where the number one place in your body is that actually has cannabinoid receptors? The breasts. And the number one way that we get cannabinoids as a little human is through breast milk. So once I actually learnt that about the cannabinoid receptors and the breast milk being the number one source, it occurred to me, as I'm sure it does with everyone, gee, maybe it's something that's supposed to be in our diet. Maybe it always was for thousands of years. And for the last 100 years, however, there's been a huge push against CBD because, if it happens to have other beneficial effects, being a painkiller or being good for preventing cancer or supporting the body in detoxing, maybe there's powers out there that don't want us to know these things. Studies on CBD as an adjunct treatment for Parkinson's disease patients have yielded promising results. Published in the Journal of Psychopharmacology, a 2009 study tested 6 Parky patients and found that the dose of CBD ranging from 150 milligrams to 400 milligrams over 4 weeks produced significant improvements in psychosis episodes and symptoms. In 2014, researchers conducted a double-blind trial with a group of 21 Parkinson's patients receiving either CBD at 75 milligrams a day, 300 milligrams a day, or placebo for 6 weeks. Increases in well-being and quality of life were observed in the 300 milligram a day versus the placebo group. Researchers hypothesized that these improvements may have been due to cannabidiol's anti-elictic, so anti-anxiety, antidepressant, and antipsychotic and sedative properties. Gee, doesn't that sound like the 3 drugs they give kids here in Australia all the time? The amount of kids I see who come in and have those 3 drugs being prescribed to them, anything from 8-year-old, anti-anxiety, antidepressant, antipsychotic, amazing. CBD isn't the only active compound in the cannabis plant, collectively called cannabinoids, that is proving its value to medical researchers. THC, the cannabinoid that conveys marijuana's psychoactive properties, has been found to be superior to prescribed drugs in the treatment of Alzheimer's. In their findings published in Molecular Pharmaceutics, researchers attribute this compelling discovery to a previously unrecognized molecular mechanism through which cannabinoid molecules may directly impact the progression of this debilitating disease. So as you can see, there's actually quite a few nutrients that have got really good studies associated. And the other one that I really want to mention is sort of more in the fish oil sort of area. So the old EPA and DHA in fish oils. For a start, with fish oils, you get what you get. If you get a cheap, nasty, over-the-counter fish oil that has not been purified, you're going to get heaps of toxins. So just be aware of that. You get what you get with fish oils. But if you get purified fish oils, the EPA, eicosapentaenoic acid, you need 2,000 milligrams a day, and that's an anti-inflammatory dose. The DHA, which I can't remember, but DHA in the fish oils, it more regenerates the eyes and the brain. So, I mean, it doesn't do what genetically. So if we've got old age eyes, it's not going to regenerate that. But if we've got deterioration because of inflammation, then it may actually make some huge impact on that. Or if we're detoxifying the body with any of our things like, glutathione or Brock shots or zeolites or, anything that helps to detox the body, then we can create space. And then if we get in there and we get the fish oils, the DHA, the EPA, the Ginkgo, the turmeric cannabinoid, and cannabinoids in there, then we can actually pull out some bad stuff and get in some good stuff and start really making a big difference to how the brain functions. So anyway, the EPA, DHA, you need 2,000 milligrams of each to do what we need them to do. So if you're after the anti-inflammatory effect, the 2,000 milligrams of EPA. If you're after the brain rebuilding effect, you need 2,000 milligrams a day of the DHA. So that's just another suggestion. And the other one that, once again, it's been a bit hard to get the last couple of years, but occasionally they get some in and we get to have it, phosphatidylserine and phosphatidylcholine. So these are 2 phospholipids that also help to recoat the nervous system. So if we have things like MS or poor memory or kids with ADHD or that sort of thing where the memory just isn't fantastic, phosphatidylserine helps your brain to get sparky again. So that's just amazing to be able to get that energy into the body. So phosphatidylserine, phosphatidylcholine. I don't know if you guys have got anyone with all these things like strokes and heart disease and memory loss and clotting issues, but all of these can help with those. So share, don't forget to like and subscribe. Take care, live your best life. Love you all. Okay, have a great day.